Good afternoon, and thanks for joining us for today's Healthline 3. I'm Jan Elkins, where we like to focus on ways to live a healthier, happier, and pain-free life. So we'll be taking your calls and answering your questions live in the studio today. We'll be opening the phone lines. As a reminder, please make sure you are in a quiet room when you call with your TV turned all the way down so we can hear you and you can hear us. Our number is 318-219-4569. Again, that's 318-219-4569. Today's topic is all about bariatric surgery, and joining me is Dr. James Barnes with Highland Clinic. Thanks for coming in.
Thank you for having me.
So let's go back to the basics. What is bariatric surgery?
Yeah, so bariatric surgery is surgery to help people with morbid obesity lose weight. And so these are people that are typically about 90 to 100 pounds or more over their ideal body weight. And what we've learned is that diet and exercise just really isn't terribly effective once you get to that certain weight. And so what works far and away the best for these people is surgery. And so that's what we offer is weight loss surgery. That's one of the sides of our practice. We also have the medical side as well. But with the surgery, the gastric bypass and the sleeve gastrectomy, and we just see really amazing results, not only in weight loss, but also just improving overall health. And that's a big part of it as well.
So the quality of life goes up because you're not carrying so much baggage around, so to speak.
It really does, in just all aspects. You know, just from simple stuff like my knees don't hurt anymore, that kind of thing. I can stand up off the floor now. I can tie my shoes. You know, all of these things that a lot of people take for granted.
Right.
That can be a real struggle when you're overweight. And so it really does make a difference in all that.
As you have said, you do the surgical side, but you also do the medical side. Who is a correct candidate for each one?
Yeah, so it's all kind of goes back to the body mass index, or the BMI, and that's sort of the initial criteria to see if people qualify for that. And if you don't know your BMI, all you need to know is your height and your weight. And if you just Google BMI calculator, you just put those two numbers in and it'll spit out your BMI. It's super easy. So for surgery, typically you need to have a BMI of 35 or greater, which roughly translates to about 90 pounds overweight. For the weight loss injections, these are the Ozempic, Wegovy, Mounjaro. The criteria is a little bit lower. BMI of 27 or greater will qualify you for the injections.
Now, all of us have seen folks who have had surgery or who are taking the injections, and as an outsider looking in, the results are tremendous.
Yeah, they really are. And again, what I said earlier, that when you get to, if you need to lose 10, 20 pounds, most people can do that by changing their diet a little bit. When you start getting into the bigger numbers, though, it just really is difficult to do that without help. And so that's where we come in, where we can offer the injections. And the average weight loss with those is about 15 to 20% of your total body weight. So somebody that's, say, 250 pounds is going to lose about 40, 50 pounds with the injections, which is a great weight loss. And then with the surgery, we see even a better weight loss than that. And most people are going to lose more like 30% of their total body weight with the gastric bypass or the sleeve gastrectomy.
So when you visit with a client, how do you determine which one is the best for that particular client? Does it always have to do just with the BMI and the
No,
weight?
There's a lot of factors there. There really are. And that's what I think is sort of unique to my practice, is that we do everything.
Yes.
And I think if you go to somebody that just offers this or that, then that's what they're going to funnel everybody into, because that's what they do. Whereas we kind of offer the whole gamut of weight loss. And so and some people come in and they already kind of know what they want to do, and that's fine. But we do educate on all the options, typical results, that sort of thing. But there are definitely pros and cons to both sides. With the surgery, we do see a better weight loss with that. It's a long-term weight loss for most people. But it's also a bigger step, and you know, some people aren't ready to have surgery. With the injections, it's certainly you know, not as big of a jump, you know, as having an operation. We don't see quite the weight loss with that, but again, it's very effective as well. There's a lot of factors. Sometimes it's weight, sometimes it's medical, you know, the health problems that people have, and how we're looking to correct those. You know, with the surgery, we know that most people, it's going to cure their diabetes, their high blood pressure, their sleep apnea. You know, all those problems usually go away after surgery, and a lot of times they do with the injections as well.
What we like to say about you and your practice is it's a one-stop shop.
It is
I mean,
indeed.
you can go here and you don't have to go someplace else to get the information or to get the option. How does that make you feel to realize that truly you may have the answer for anyone who's looking for weight loss?
Yeah, and I think that's why we have sort of spread out into everything, because I just think you know, weight loss is kind of complicated. I mean, there's a lot of options out there. It can be very confusing. You know, a lot of people come in and it's like, I know I'm overweight, but I don't know what to do. I don't know how to get down to that goal weight that I want to get to. And that's where we can jump in, and we do, you know, we do small group seminars all the time, just to sort of, you know, get some more information out there. And then, but even when we do that, we really focus on individual, one-on-one conversations, because, you know, part of it, you know, not everybody has the same goal with weight loss. And so that's part of my job, is to, you know, communicate and figure, okay, what are your goals? What are your expectations to get out of this? And then we can tailor that program to meet each individual patient's needs, because it's different with everyone.
Right. Now, you mentioned the seminars, and those are typically on Tuesdays, right?
They are, yeah. We do a free seminar every Tuesday morning at 8 o'clock, and that's mostly geared towards the surgery side. And that's a great way for people to just come in, get some information about it, you know, and you can get online and learn a lot about it as well. But there's, you know, sometimes you got to take that with a grain of salt a little bit. And so, you know, we offer, you know, sort of just, you know, in my experience, and I've been doing this for about 30 years now, what works, what doesn't, what are the pros, what are the cons. And so just kind of a real honest presentation of what the options are out there, and then, you know, help kind of guide people where they need to go.
Well, we do have a caller. Miss Dunn is on the phone. Go ahead and ask your question to Dr. Barnes. I don't think we were able to connect all of the dots there, but we were talking about your seminar. One thing I'm interested in, and maybe we can get her back on the phone. To me, personally, eating is such an emotional thing. You know, we sit around the Thanksgiving table and it's family, but it's comfort food. Do those seminars help retrain your brain about how to look at food?
Yeah, that's a big part of it, like you said. I mean, we eat for a lot of different reasons. Hunger is obviously one of them, but it's only one. There are plenty of other reasons why people eat or overeat. And so that's a big part of it. You know, most people that are morbidly obese tend to have some degree of a food addiction, honestly. And so that's also part of what we focus on, is not just, okay, here's your surgery, off you go, or, you know, here's your shots, off you go. Right. You know, 'cause, I mean, that's part of it, but you know, the aftercare program, the follow-up, is so critical to achieving success with these, and that's part of the stuff that we talk about every time patients come in, is how we can sort of change this part where people are maybe finding healthier ways to deal with, you know, whatever that is. Correct. Rather than, you know, reaching for a bag of potato chips.
Good advice. Lola's on the phone now. Do you have a question for Dr. Barnes?
Hello.
Hi, how are you? Go ahead with your question.
Yes, ma'am. To ask Dr. Barnes, I have a child that's 15 years old. It's a special needs child. She's now 230 pounds because she takes a lot of steroids to overcome or compensate for what her body doesn't produce. And it has caused her to become become extremely overweight. It's not due to eating. It's actually due to medical use. What in the world can I do for this child? Is she a candidate for any type of bariatric or anything?
Yeah, that's a great question. And, really obesity, for the most part, does still kind of go back to calories that you're taking in. And so I'm sure that's some of it. At 15, she's going to be a little too young for surgery. Most people, including myself, don't offer surgery until they're at least 18. So that, she wouldn't be a candidate for that right now. We have done the injections in adolescence, and that could possibly be an option that might be helpful. And that's something that we could, sit down and talk about if that's something you're interested in.
Yes, it is. Thank you.
You're welcome. Thanks for your call.
So Lola brings up a good point that sometimes medications can contribute to being a little overweight, but maybe not morbidly obese.
Yeah, and again, obesity has got so many factors in it, but yeah, whether it's, and the common medications we see, steroids are one, and some of the antidepressant medications have a real bad side effect with weight gain. And typically what that comes from is increased appetite on those medications. Mm-hmm. And so again, it does usually eventually go back to calories taken in. And we look at that as part of the program as well. And sometimes, we'll talk about, well, maybe, there are better, options medication-wise that could help. And, we work with the primary care doctors on that sometimes. If this antidepressant has caused a lot of weight gain, well, maybe we could change the dose, try something else to see if, maybe it could lessen that effect.
So you talked a little bit about the bariatric surgery, and you consider it safe or you wouldn't do it.
Yeah, it's not without its risks because it is surgery, and there are certainly risks that go along with that. And when we do our weekly seminar, we kind of go through all that. Now, the good thing is that first of all those risks or complications are rare. Most people are going to go through without any major issues. And what I always tell people is you sort of have to weigh both sides. There's risks to surgery. They're small, but they're real. But there's also risk to not having surgery.
That's right.
And morbid obesity and all of the health issues that go along with that, especially as we get older. And so that's, part of what we do is you got to weigh both sides. But honestly, for most people, I think the risks are greater to not have surgery and be morbidly obese.
And what about the risks or side effects of the injections? Are there any?
There are, and I put those sort of in two categories. There's the ones that are more common but not as severe, and most of those are GI related, and far and away nausea is the most common side effect that we see with that. Somewhere between 30 to 40% of people have some issue with nausea when they're doing the injections. Usually it's mild. What I typically hear is like the day of the shot, I feel a little nauseated sometimes. I do have a few people that we actually have to prescribe nausea medications for when they have a bad day with it. Most people it's not that severe. Usually we can mediate that to some degree by altering the dose or the frequency and things like that, and get people where it's not a big issue. There are some more serious side effects, but they are super rare. There's been incidents of pancreatitis, of thyroid cancer. Those are a couple that you hear about. Again, very rare. I've never seen any of those personally in any of my patients, but that's part of the education process that we go through with everybody is explaining all those potential complications. But again, it goes back to the same thing as with the surgery. There are some small risks with the injections, but usually greater risk with the obesity.
If you don't do something about your weight.
Exactly.
So when we talk about some of the side effects and some of the injections, once a person decides injection is the way I want to go, injections, whichever one I choose, that's what I'm going to work with in my weight loss situation, do you stay on those shots forever?
That's a great question. And to me, that is one of the things that I think it's important to talk about, because we know with the injections, if you stop them, most people are going to start gaining their weight right back. And that's true with any weight loss medication, whether it's a pill or a shot. And so I try to tell people that this is going to be probably a long-term commitment with this. Now, once we get people down to the weight that they're trying to get to, we usually start slowly going back to more of a maintenance dose. And so that can be either a lower dose weekly shot, or sometimes we'll even go to every other week on the shots. And sometimes we will even switch back to oral medications like Adipex or something like that once people get down to where they want to be. But if people just kind of go cold turkey and drop it off, most people are going to start gaining that weight back.
And is that also a concern with the gastric sleeve process? I mean, we've all seen people who went through it, lost a ton of weight, and then maybe 5 years later, they gained some weight or too much weight back. It can happen with anything, anytime.
It can. Nothing is 100% with weight loss, and there are ways to eat around it, get around it. And that's part of why the follow-up is so important, because it's clearly shown that people that come in on a regular basis are going to do dramatically better than those that are just kind of out there winging it on their own. With the surgery, we do, again, for the majority of people, that's going to be a long-term weight loss or a permanent weight loss. But there is a small percentage that will regain weight. We see that a little more with the sleeve than we do with the bypass. It's less common with the gastric bypass. You can regain with either one, though. Most of the time, the weight regain comes from just sort of what we call maladaptive eating. People learn to eat around that, and that's usually with high calorie dense foods. And typically that's the snacking type stuff, the chips, the nuts, the crackers, that kind of thing. Or it's the high calorie drinks, sweet tea, regular sodas, fruit juice, that sort of thing. And those are some of the things that we really try to get people to steer away from, and offer maybe some better options rather than what they're used to reaching for.
But there have been, since bariatric surgery has been in place, there have been a lot of advancements as far as the surgical aspect, the treatment of it, even maintaining the weight loss, hasn't there, in the last 30 years or so?
Oh yeah, and bariatric surgery's been around for a long time. The gastric bypass, for example, and that's been modified a little bit over the years, but they were doing those over 50 years ago. So It's been around for a long time. One of the big things that's changed is how we do the surgery. When I first started doing these about 30 years ago, everybody got a big open incision on their belly when they had surgery.
Right. Now the robots do it, or laparoscopic. Or
yeah, well, we did the laparoscopic surgery starting in the late 90s. Did that for a long time through the little incisions, which was a big advance. But we've moved into the next stage of surgery now, which is, as you said, the robotic surgery, and that's been even a better advance than the straight laparoscopic, where we do still through the small incisions, but instead of me standing at the table working, we now have the robot at the table, and then I'm over in the corner of the room sitting at a console controlling the robotic arms, which are moving the instruments inside the patient. And so
technically you are still doing the surgery,
yes.
You're performing the operation, you're in the room, you're actually moving the handle that moves the hand.
Absolutely.
That actually does that. And you're also seeing it in a computer screen that helps you see the body a little bit better.
Yeah, when we sit at the console and we're looking through this screen, we have a 3D image, beautiful optics in there, so I can actually see better on the robot than I could in the old days when we did this wide open. And so, I can zoom right in on where I'm working, and just have great dexterity with the robotic instrumentation. Really amazing the stuff we can do with the robot now.
That's awesome. Katie's on the phone now. Katie, go ahead with your question.
Yes, I had to ruin my gastric bypass a little over 20 years ago, and I have in the last few years gained 40 pounds of that back. I know it's possible for my stomach to stretch. What can I do to get back on track to lose that 40 pounds?
So
Can
there
you
are
unstretch it?
Yeah, there are a lot of things. Most of the time it's not, everybody kind of associates weight regain to their stomach stretching out, but that's actually usually not the case. Most of the time the stomach still is the small size. but it's what we were talking about earlier, that maladaptive eating. And so one of the things we talk about, and there's kind of three things that we talk about avoiding after bariatric surgery, or really for anybody, is the high calorie drinks, fast food, and the snacking. And those are usually the areas that get people into trouble. And so sometimes we can just do some modifications of diet that will help a lot to get that weight going back down. And then there's also the medical options. We use Adipex a lot, phentermine. It's a pill that you take that suppresses appetite, and that works very well. That's a great tool. We use that a lot. And then the injections that we were talking about earlier, and I have a lot of patients that are on those that did have surgery in years past, and kind of like our caller, gained some of that weight back, and then we can get them on the injections, and that gets them sort of back on track with that as well. So there are definitely options, and we can certainly help with that too. I see a lot of patients that had surgery years ago, some by me and some by others around. But if you're interested in looking into that more, you can certainly call the office, and we can get you in and help you start losing some of that weight.
Dr. Barnes, let's give them the number for your office so they can call there, if you don't mind.
Yeah, sure. It's 318-798-4433, and you can call, and Ashley and Taylor are going to be the ones answering the phone, and they can kind of get you started on what you need, if it's an appointment, if it's a seminar, all those things, to kind of get things started. You can also, if you want to just sort of get online and look, the Highland Clinic website, highlandclinic.com, and you can find me under the providers there. I've got some stuff there. And also on Facebook. It's just under my name, James Barnes, MD, and that's a good resource too. I do a little weekly video segment on there called Weight Loss Wednesdays, and you can look at those and some helpful tips. I did one a week or two ago showing the robot that we were just talking about.
Good.
So you can kind of see how that works and what that looks like.
And I'm sure those stay on your website so somebody can go back and look at that.
Yeah, those are on the
a couple
Facebook
weeks.
page,
Yeah.
and I just keep them all on there so you can go back and look at any of those.
Great. So what I'm hearing you say is you've been in business for 30 years. You are busy now, but you're still able to take new patients like Katie, who's asking about if she could come in and get some help.
Absolutely. And again, like I said earlier, the follow-up is so important. If people are out there trying to do this on their own, it's just hard, for several reasons. First of all, just kind of knowing what to do, what to eat, what to not eat. If there's sometimes we can help with medications, that's a big thing. Part of it too is just the accountability of coming in and seeing somebody every so often. It's just, when you're going to come in every 3 months and step on my scale and all that, it just keeps you focused on it a little bit more. And it's just human nature. We all do better when we're being watched a little bit. And so I think that most patients find that very helpful too.
Well, and it is the truth that, it is hard to do it on your own. You certainly do need a professional, a physician like Dr. Barnes, who would be able to walk you through any and all of the options and figure out the one that is correct for you, but also to be there to walk your hand through the follow-up process, because it's not just a one and done. This is a commitment of several weeks, several months, or for the rest of your life, and you want somebody to kind of be watching that.
It really is. I always tell people, weight loss or obesity is a lifelong battle. We can offer a lot of really great tools to help with that, but there's no magic wand, there's no, trick solution to it. It's something that you really have to deal with day to day for the rest of your life. But doing that on your own is really hard, and that's, when we can help with that in all sorts of different ways, it does give you some real powerful tools to win that battle on a day-to-day basis.
And just to realize that people who are so judgmental about those who are overweight, if we want to use that term, or even obese, it gives you support to see that you're not alone and there are others who are in the same situation as I am.
Oh yeah, absolutely. It's funny, today, I was on vacation last week, so my office was really busy this morning, and so the waiting room was pretty full, and they sort of had a little mini support group out there in the waiting room, and everybody was just talking about, because I had people that had been years out from surgery, still considering surgery, working on the injections, and it was kind of fun. Everybody that came in was kind of excited that they'd been able to sort of have this little mini support group out there in our waiting room today.
It makes a big difference.
It really does. Just seeing that you're not alone in these struggles. Obesity is so endemic in the South, especially, and it honestly
we do like our food, don't we?
We do, and Shreveport is always in the top 5 cities, most obese cities in the United States.
Wow,
Shreveport
I did
is
not know
always in the
that.
top 5, and so certainly not alone in your struggle with this.
Now, we've talked a little bit about your Facebook page and a couple of ways people could get a hold of you, but remind me of that Wednesday seminar that you do on your Facebook.
Oh yeah, it's called Weight Loss Wednesday.
Weight Loss
And we do
Wednesday.
that
I like that.
every Wednesday morning. It's just a little 3, 4, 5-minute video, and we started it about 6 weeks ago. And we talk about, again, everything we've kind of been talking about today: the surgical side, the medical side. We did a demonstration of the robot last week. We're going to talk to some patients and have just kind of some patient testimonials of how their life has changed,
right,
with the weight loss. And so it just had a real good response to that.
Super.
And kind of excited about that, and we're gonna keep that going. So.
That's fantastic. Now, I know you've been used to seeing Dr. Barnes on Healthline 3 on Mondays, but now he's going to move to Fridays. The first Friday that he will be appearing on Healthline 3 is Friday, September 27th. So let's talk about that a little bit, because you've been doing Mondays for a long, long time, but now you will be able to work your way toward a Friday at 12 o'clock.
Yeah, and we thought it would just be nice to see if we could maybe pick up a little different audience. People have different work schedules and whatnot. And again, this is why we do this, is just to get the word out there,
right.
Let people know that there is help, there are great options to help lose weight, and by switching to a Friday, we thought maybe we'd pick up some new people that haven't been able to catch us on Mondays at all.
And I think you've talked in length about the fact that each one of the options may have some side effects, but nothing could be as bad as carrying that weight around.
Yeah, that's really true. And that, whether you're talking about surgery or injections or pills or any of that stuff, the side effects are pretty rare. But I tell you, obesity it just wrecks people's health. And people in the 20s and 30s, a lot of them are still pretty healthy. But when you start getting in your 40s and 50s, it really catches up with you. And that's when we start seeing the diabetes, the high blood pressure, sleep apnea, joint problems, reflux. I can tell you 100 things that are caused or worsened by obesity. Cancer risk goes up, heart disease, all these things. And it just has such a negative impact on your health. Life expectancy in somebody that's morbidly obese is 10 to 15 years shorter than people at a healthier weight. And so, when we have options where people don't have to live like that, they can lose that weight, get healthier, get off their medications, feel better, be more active, be able to do stuff with their kids or their grandkids. I hear that a lot, that, people say, I just can't keep up with my
right.
children or my grandchildren
I can't
anymore.
get down on the floor and play with them, or I
Exactly.
can't ride the roller coaster. I'm out of breath, or whatever.
Yeah, I can't get on a plane to fly to go see, whomever.
Right.
All these things. And again, most people kind of take that stuff for granted, but these are real struggles that people with obesity, have to deal with.
10 or 15 years less time with your family, less time in life. That's an awful long time.
It's huge. It's huge, and it's not only the quantity of years, but it's the quality.
The quality,
of the
absolutely.
years.
There's no real benefit in living to 100 if for the last 25 you can't feel good, you can't do anything.
Exactly.
Dr. Barnes, we appreciate so much you being with us. And one last time, give us your phone number at your office.
Sure, it's 318-798-4433, and we'd be happy to answer any questions there, and hopefully get you started on a better path.
Doctor, thank you so very much. And just again, a reminder that he is going to now be moving to Fridays for Healthline 3 once a month. The next time that he's going to be on Healthline 3 will be Friday, September the 27th. You'll want to watch our 11 o'clock newscast for Health Watch 3 that day, and then join us at 12 o'clock for Healthline 3, Friday, September 27th. Thanks for joining us.